Hi, I'm Dr. Samantha Johnson. I am the curator of the Layman's Doctor, a holistic medicine brand which is focused on bridging the gaps between healthcare workers, the healthcare system, and patients. I am a Jamaican doctor. I have created, or I'm in the process of creating, a YouTube series called A Branding Guide for Healthcare Workers, and it's really aimed at helping healthcare workers navigate social media, creating a brand for themselves, publishing things or posting things about their practice, posting fun videos, and all sorts of things. I've already spoken about in a previous video how to post patient advice online, and I thought I would do a video on how to post patient education online. Now, these two things may not seem that different. However, the difference is with patient advice is that you are telling people to do something. So for example, you're saying, if you are having running belly, you're having symptoms of gastroenteritis, you're having diarrhea, vomiting, nausea, some advice that you could give in a post or in a video or any type of way is that you could say, ensure that you drink lots of fluids. You can give the warning signs or give signs that people should look out for to say, hey, you need to go to the hospital right now. And that could be signs of severe dehydration, if you're unable to keep up with your hydration, if you see blood and stuff like that. No, that is patient advice. Patient advice is more you giving solutions for a possible problem. It can also be preventative. Another part of patient advice that I did talk about as well was I spoke about how much I like to watch stretching videos. That's also a part of patient advice. Now, in patient education, a big part of healthcare is health promotion and health education. And I think that all healthcare workers play a very valuable role in providing health education. This is something that we tend to do when we see patients. So you have a patient that is a newly diagnosed diabetic, or a newly diagnosed hypertensive, or someone who has sickle cell, and each time you have a consultation with those patients, you talk a little bit about the illness, what the illness means, and how it can be treated. That is patient education. Now, patient education in this setting is basically doing more or less the same thing, where you're providing information about a topic. It can be a disease process. It can even be about what type of doctor you are, what type of doctor to see, what type of healthcare worker to see, when do you need a physiotherapist, when do you need a chiropractor, and things like that. And all it does is provide information. Here are some things to keep in mind. You have to keep in mind your audience. Who are you trying to give this education to? And because it's titled patient education, of course it is directed towards patients. But what type of patients? Are we providing content for pregnant women? Are we providing content for women who would like to become pregnant? Are we providing content for persons who are caring for elderly persons? Are we providing content for persons who have feet problems, issues with nails? And keep in mind who you're talking to, and not just who in the sense of what issue they may have, but also you want to remember that you're talking to patients who may not have medical knowledge. So you're not talking to a doctor who just happens to also want to become pregnant or who is pregnant. You're not talking to a nurse who has an ingrown nail. So when you keep in mind that you're talking to these patients, they may be women, they may be men, they may have specific medical needs, you're looking at the age range as well. It really helps you clue in what type of language you're going to use, and you're going to clue in what type of maybe even media or what way you're going to present the content as well. So for example, in this video can use a lot of jargon, even though I try not to, so that persons who may just be interested could also watch it. But you couldn't really fault me for using a few medical jargon because it is a video directed towards healthcare workers. It is almost my assumption that healthcare workers understand what I mean when I say hypertensive, or if I said something like sterile, or what I mean if I use the acronym CPR, right? That's because my specialized audience are healthcare workers. I was on the radio, and no, I was not on the radio. I was listening to the radio the other day, and there was a medical doctor, I'm not sure who it was, talking about a disease process, and it sounded almost akin to a medical lecture. There was a lot of jargon. You'd have needed a lot of specialized programming, and even when listening to the host trying to kind of get engagement, you can tell that it was a conversation that was going over their head. That's not because they're not intelligent or they don't understand what's happening, but that's simply because that person used so much medical jargon that if you did not already know about the topic, if you did not study the topic in school, or it wasn't a part of your training, it would have been really hard to actually follow along. So that's what I mean by knowing your audience, right? If you're going to go on a radio show and you're giving general knowledge, general information about a health issue, about a certain disease process, the way how you're going to want to talk about that is in a way as if you are explaining it to like your grandmother, or you are explaining it to a child, or you are explaining it to a friend who is not in the medical business. So you're going to want to really break it down and simplify that and put it in a way that persons who are not in medicine, who are not in healthcare, can understand. And that is really why I want you to focus on knowing your audience. Knowing who your audience is can also help you know how you're going to present this information, right? Here in Jamaica, where here in Jamaica, where internet penetration might be an issue and persons still listen to a lot of radio, if you maybe want to reach to the older generation, or you want to reach to a more rural generation, a place that doesn't have a lot of internet access, you may want to choose radio or newspaper, or even a social media network such as Facebook, where a lot of persons are on it because our network providers have 0 rating for Facebook and so on, and it has been shown through the data that is the most used social media app here in this country. So just knowing who your audience is can really help you know what direction to go with your content, how to present it, and where to even present it. Keep it simple. And I feel like I covered that, but remember, you're not giving a lecture. You are not at a conference presenting. You are providing bite-sized pieces of information, because what you are trying to do, and knowing the purpose for this is super important, but what you're really trying to do is empower your audience. So when you're talking about, here are some reasons why you might need a chiropractor, you can say in a fun video, back pain, limited flexibility. You are presenting this bite-sized piece of information in a way that it's super easy to grasp and it can catch your attention, and you're keeping it really simple. No matter how you're doing it, no matter what you're talking about, no matter what you're educating the person with, keeping it simple is a surefire way to actually get people to engage with it. Say, for example, someone posts a graphic and it's hard to read, it has several paragraphs. Who wants to read that? Unless it's something I'm super interested in, it's highly unlikely I'm gonna read it, right? And if as soon as I open it, you're talking and you're using these very confusing large words, these big words, the way that you're speaking is convoluted, persons may not also be interested. So keep it simple. As a principal at my school used to say, keep simple things simple. And another surefire way to get information across is with the use of storytelling, using examples. Even in this video, I've used examples, I've used stories, and that's a great way to get people involved and get them engaged. It's not just a poster of disease name, symptoms. It's not a bullet sheet. I mean, of course you can do that, but I like, especially if you're doing video form, if you're doing a video form type of posting, storytelling can be super important. Now, I'm going to share a little joke. I have it written down here, and I'm looking at my viewfinder to make sure you can see. I have it written down here, right? What I want to talk about. But that last point, we're just going to have to move over that, because I don't know what it says. I don't know what it says. I have no idea what it says. And I'm just going to move on to my next portion of the video, when I'm going to talk about delivery. How are we going to deliver this patient education? All right, let's go. Now that we know who our audience is, it's time for us to think about how are we actually going to deliver that content. You can use different social media platforms such as short videos like TikTok and Reels. You can do story times where maybe you have a chat box and you ask people to send in questions, and you say, every Friday I'm going to answer your questions, your gynae questions. Every Friday I'm going to answer some general medical questions, and you have a topic and you can engage your audience like that. It can be that you do written content, and that can be long form on a blog, in the newspaper, or you can do it short form where maybe you have little graphics and they can swipe. I do that a lot, where I have a little graphic and you can swipe on it. There's so many ways that you can deliver your content. You can have a podcast, you can do a video series, you can have a television show, you can have a radio show. There's so many ways that you want to deliver your content. When you have decided how it is you want to do it, and why I was so quick to show you even my little outline, is that no matter how you're delivering the content, writing it out and having a plan is really great. So here I have my title, I have some key points, I have an outline, and I even have a script written out. And right now I'm really playing around with how I want to organize my content, organize my thoughts to help me with the delivery of my content. And while you guys are here with me, I'm hoping that as time goes along, you'll realize that Samantha is doing much better at how she produces and delivers these videos. So have a plan, and it can really just be a plan on what you're gonna say, where you're gonna say, or even when you're gonna post. You know, are you gonna post about breast cancer during October? Are you gonna post about colon cancer? And just being deliberate and showing persons that you put some thought into how you're delivering your content. So let's just touch a little bit on the different social media platforms. I'm really planning to do a video that's completely aimed at looking at different social media platforms, and more specifically the ones that I use, and different ways that you can use these platforms to help build your brand, build your clientele. Let's choose my favorite one. Right now I'm using Instagram and I'm using TikTok a lot. Instagram has several features. As I said, they have the stories feature, where you can just post stories, and there are things that people just click through. They can read it, they can be videos. I wouldn't suggest doing a video type format where you're really holding your phone up and talking about a disease process on your story. If you're gonna do that, you might as well just make a long form video. However, I think that stories are good for interacting with your audience, having them ask questions, doing polls, and really even helping you get content. There's also a feature where you can do live. A lot of organizations people, influencers do lives. Maybe you can have every Monday we talk about women's health, and that's it. You can bring on people to have a conversation about that, or it can be a discussion of just you, and persons can ask questions. Maybe you're talking about a topic, and then on Instagram itself you have posts where there can be pictures and you have a caption, or you have different carousel posts, and of course you have reels, which is very akin to TikTok and posting TikTok stories or TikTok videos, and those can be way more fun, way more entertaining, and you can really play around and do it however you want. And we're going through this quickly. We have Twitter. Twitter is great for threads. It's also great for interacting with your audience as well. And now Twitter has also made a newsletter type of setup as well. And Facebook is good. You can have conversation, polls, you can post your videos. So using more modern media is great if you're trying to build an online brand. But this specifically, you can write letters to the editor. I wrote a Dear Editor letter for sure about sleeveless, and I've also written kind of I can't remember what they call it, but it's kind of like a specialist column. I wish I can remember the phrase, and I wrote it about HIV. Those are things that you can also do. Send in those articles. You can have a blog, and on your blog you can do anything. You can post your podcast, you can host your radio show, you can have your long form blogs, you can have your videos, everything. So there's so many ways that you can deliver your content, and I'm really hoping to just create a separate video on how you can do that, and how you can use the different social media platforms to just build your brand and share more about your career, what you want, share more with your audience, your potential clients. No, what I would say is that when you are thinking of doing this, it's important that you think about how exactly you want to present this information. You want to present this information in a way that is going to catch the interest of your audience. Now, when you are building your personal brand, you're not trying to be a one size fits all. You have to understand that not everybody is going to want to engage with you, not everybody's going to want to watch your content, but what you really want to do is find people who are going to watch you, interact with you, stay with you, build a community around you, and help you build and spread your brand awareness, and maybe even at some point help you to monetize, whether that is through your online brand or through getting you customers, new clients, new patients. Even if you're just giving patient education, you have to safety net, especially if it has to do with a disease process. If you are talking about the symptoms of diabetes, you don't want to just write, hey, the symptoms of diabetes are, polyuria, polydipsia, and of course you're going to talk about that in a way that you're not using those jargons. So even right there, I was testing you. You should be saying, but Samantha, why would I use the word polyuria? You could use the phrase polyuria and give a definition of it, or you could simply also just write it in simpler terms, whichever one you want to do. After you give such information, you don't want to just end it there and move on. You may want to say, if you or someone you know is experiencing these symptoms, please see your nearest physician. It could even be a call to action to come in to see you, so it could be a form of advertisement, or it could you could also have a warning as well to say for example, you are giving education on a procedure. You may want to add, do not try this at home. This has to be done by a trained specialist, and so on. So in our profession as healthcare workers, because we are talking about people's lives here, even if it's just from cosmetic medicine all the way to anesthesiology, you still have to safety net. You still have to give disclaimers, you still have to give your warnings, and you still have to encourage persons to seek care if they need it. So because we are in healthcare and we are giving education to empower persons after they have the information, you also want to help them see how they can use this information. I think that giving patient education online is a great way to show your skill set as a healthcare worker, to talk about your career in a fun way, your profession in a fun way, and to share insights into your profession. And I also think it's a great way to help clients get to know you and get to know you exist. Posting about patient education online has so many uses, but the most important use is really about empowering your patient. As you go along in this series, you'll understand that I'm going to be talking about branding for healthcare workers from several different aspects. If you are a healthcare worker that's interested in branding, but you're not interested in posting about patient advice, posting about patient education, posting patient experiences, I will definitely still have videos for you. But this is a great way to create content that is really simple, because you're already doing it. You are already talking to your patient every single day and giving them education on the disease process or potential disease processes and preventions, or what even certain healthcare workers' jobs are. You're already doing it. All that's left now is to put it in a way that's online. That's really it. I really hope that you have learned and have enjoyed this video. I hope that there's some useful tidbits. If you know somebody who you think would benefit from this, please share it with them. If you liked it, just give me a thumbs up. Please subscribe. I'll be coming out with much more videos about branding for healthcare workers. But because I'm a healthcare worker and I'm interested in branding, I just wanted to share some of the things that I've learned on the way and some of my thoughts. Of course, I want to hear your thoughts down below. I want to hear your ideas, your thoughts, your everything. Just have a conversation down below. Is this something that you're even interested in? Do you already post about patient education online? Do you write to the Gleaner? Do you write to your local newspaper? Stuff like that. I really want to know. And until the next video, I cannot wait to have this conversation and talk with you guys again.